When you're breastfeeding your baby, there are many different positions you can use. You need to find what works best for you and your baby. The length of your arm, the baby's size and shape today, and where the nipple points will help determine that. If your baby has given you feeding signs, you can position your baby at the level of your breast. Be sure that you're also relaxed, pillows behind your back, pillow to support the baby. If you need a rolled cloth under the breast for support, that can be helpful. We aim for ear, shoulder, hip of the baby to be in a line. It allows the baby to swallow in that position. Place your hand at the shoulder blades, thumb and finger at the ear level so that you can gently tilt the baby, allowing the chin to be close to the breast. If the baby brings the chin down, the tongue goes back and the baby's unable to use the tongue to cup and wave and get the milk out of the breast. So be comfortable, lightly touch the nipple to the baby's nose, lips, to allow the baby to have the mouth wide open, and then aim the nipple to the roof of the mouth. When the roof of the mouth is tapped with the nipple, it triggers the baby to close, cup and wave the tongue. You may assist the baby by compressing in the direction of the baby's gums to get more milk to transfer. Every drop is important. In 1/3 teaspoon of your early milk are 7 million antibodies. Keep the baby nice and close to your body. You can also place a rolled cloth under the baby's head if you need that for support. Some others find it comfortable to use a footstool. The furniture will also factor in. You can use the arm to keep the baby's bottom close to your body. It also helps with the tilt of the baby's head. You will feel a tug, but not a pinch when the baby's on correctly. If the latch is less comfortable, bring the chin in closer. Sometimes it gets the baby further back onto the breast, or assist by doing the compression of the breast. When they pause to breathe, the baby will often relax and sometimes they slide back on the nipple. When they restart, it may be uncomfortable, so allowing the baby to stay nice and close during the rest periods can maintain a more comfortable latch throughout the feeding. It's best to avoid pushing the baby at the back of the head. The baby has a reflex. They will move the head back to meet the hand, and they will actually come off of the breast. So this assistance is all that you need. Allow that chin to touch the breast. Once the baby latches, the cheeks are puffed out, the jaw will drop rhythmically. There's no discomfort. You may feel a gentle tug, but there's no pinching or pain of the nipple. The baby will do several sucks. The swallow is a very quiet sound. It's a puff of air, ah, ah, is what you will hear. The baby will also do some rhythmic sucking, swallowing. They'll pause, rest, and breathe. That allows the baby to maintain a high oxygen level in the blood. If the baby has paused and you feel they may want more milk, you could compress the breast to get more drops in their mouth. You could also circle the baby's crown. That can stimulate the baby's suck response. Other things that would work if you have help: tapping the palm of the hand, tapping the sole of the foot would also stimulate the baby to do sucking. When the baby is done feeding, you could position the baby in a skin-to-skin hold. That's a good position for them to burp. You can gently rub or pat the back. Sometimes the baby will make a squeaky sound before they burp. If they sneeze, that counts as a burp. And they frequently hiccup after they do their feeding, and that's perfectly fine and healthy for the baby.
If you need help or advice with breastfeeding, call one of the lactation consultants on the warm line at 1-800-711-7011 or speak with your pediatrician. Additional resources are available on our website at womenandinfants.org.